My name is Shamary Valdospin, and my topic is the heart. Definition: the heart is an involuntary muscle that acts as a pump to send blood through your body.
Welcome to educate.com. This video talks about heart. The heart is an organ which beats continuously to act as a pump for transport of blood, which carries other substances with it. Heart works like a pump non-stop for as long as a person lives. The heart is located in the chest cavity with its lower tip slightly tilted towards the left. Heart typically is of the size of a fist. Heart has 4 chambers. The 2 upper chambers are called the atria or the atrium, and the 2 lower chambers are called ventricles. The partition between the chambers helps to avoid mixing up of blood rich in oxygen and the blood which is rich in carbon dioxide. The blood flows from the heart to the lungs and back to the heart, from where it is pumped to the rest of the body. Thank you.
How does the heart work? The heart is a muscle that pumps oxygen-rich blood and nutrients to body tissues, the blood vessels. The heart keeps the blood moving in the body in directional. It is closed circuit, nothing is lost. The atria receive blood returning to the heart. The ventricles pump blood out of the heart. Arteries carry oxygenated blood from the heart to the body tissues. Nutrients in tissues extracted and returned through the veins. Veins carry blood back to the heart. The heart's electrical system controls the rate of the heartbeat. Application in medicine. Cardiac pacemaker. It is a small battery-operated device that sends when the heart is beating irregularly or too slowly. This sends a signal to the heart which makes your heart beat at the correct pace.
A pacemaker can be fitted to help regulate the heartbeat with small, evenly timed electric shocks. This involves implanting electrodes into one or more of the heart's chambers by inserting leads into a vein near the collarbone and implanting a device called the generator just under the skin. For more severe heart conditions, an implantable defibrillator, or ICD, can be used, which is also capable of sensing a stopped heart and delivering an electric shock powerful enough to restart it. For some conditions, an even more sophisticated device, called a CRT ICD, can be implanted. This uses a third lead inserted into the left ventricle to resynchronize the ventricles when necessary. However, all these leads can cause problems of their own. Patients with ICDs have a 20% chance of a lead failure within 10 years, and replacing leads can require open heart surgery in about 2% of cases. This has resulted in several efforts to develop new pacemakers that do not depend on leads inside the heart. One design, the subcutaneous ICD, places the lead just outside the heart under the patient's skin. And wireless designs are now being developed that may eventually do away with the need for leads altogether.
Description: Newer pacemaker with only and once. A pacemaker usually has 2 parts. The generator contains the battery and the information to control the heartbeat. The leads are wires that connect the heart to the generator and carry the electrical messages to the body. A pacemaker must be implanted under the skin. This procedure usually takes about an hour. A patient will begin sedate to help you relax, but the wait during the procedure. Why is the procedure performed? Pacemaker can be used for people who have heart problems that cause their heart to beat slowly. When the heart beats too slowly, it is possible that the body and the brain does not receive enough oxygen. Symptoms: may include disease, fatigue, finding speed, and shortness of breath. Advantages: it provides enough tissue blood which carries oxygen, substrates, and nutrients for daily metabolic needs, both at rest and inactivity. Amendment: cardiac adapt according to the psychological current priorities, sometimes muscular exercise, heat loss or digestion, as well as in some pathology process to protect vital organs such as the heart and brain when these severely compromise cardiac output. Disadvantage: it formed with a cardiac alteration and not maintain a healthy life we could have some disease such as heart failure, arteriosclerosis, hypertension, cardiac arrhythmias, cardiac murmurs, and others. Coronary artery disease is one of the most common and serious effects of aging. Fat deposits build up in the blood vessel wall and narrow the pathway for the movement of blood. The resulting condition, called arteriosclerosis, often leads to eventual blockade of the coronary arteries and a heart attack.
Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. Two conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal.
Case: high blood cholesterol, high blood pressure, smoking, obesity, and lack of physical activity. Treatment: DASH eating plan, dietary approaches to stop hypertension, perform exercise, control stress, stop smoking, maintain a healthy weight, cardiac rehabilitation, drug second medical prescription. Surgical procedure is warranted and angioplasty. Hypertension, also referred to as high blood pressure, is a medical condition in which the blood pressure chronically elevates. Persistent hypertension is one of the risk factors for stroke and heart attacks.
The heart pumps blood full of dissolved oxygen to the body through the arteries. Arteries are not simply tubes, but have elastic walls made of a special type of muscle. The muscle can constrict or dilate, making the arteries narrower or wider.
Damage to the inner wall of the artery causes fatty substances in the bloodstream to stick to it, forming plaques that make it stiffer and narrower in the process, called atherosclerosis.
The kidneys play a part in controlling blood pressure by removing water from the bloodstream and excreting it in urine. They control the body's total volume of blood and thus the blood pressure.
Renin-angiotensin-aldosterone system, or RAS, or RAAS, plays an important role in maintaining a normal blood pressure. It controls the blood volume, blood pressure within the blood vessels, and functioning of the heart. Renin is an enzyme primarily released by the juxtaglomerular cells of the kidneys and also found in other tissues of the body. These enzymes are activated by the prostaglandins released by macula densa. Closely packed cells found in kidney, macula densa, are sensitive to change in levels of sodium chloride, NaCl, in the fluid that passed through them. Renin is released in response to sympathetic stimulation, fall in blood pressure within the renal arteries, and depletion of sodium levels in the distal tubules. The released renin acts on angiotensinogen, a glycoprotein synthesized by the liver. Renin cleaves the angiotensinogen to form angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by angiotensin-converting enzyme, or ACE, found in the capillaries of the lungs. ACE also inactivates bradykinin and other vasoactive peptides. Other than ACE, enzymes like cathepsin G, elastase, tissue plasminogen activator, chymostatin sensitive AT2 generating enzyme, and chymase can also convert angiotensin 1 to angiotensin 2.
Discover more at Focus App Store, the simple way to explore science and medicine.
In 95% of patients with hypertension, there is not organic case. Blood pressure is caused by hereditary dispositions and external risk factors such as obesity, stress and excessive alcohol consumption, and salt. Organic disease or hormonal disorders are responsible for hypertension in only 5% of cases. Consequence: heart has to work harder, left ventricle enlarged. Atherosclerosis might affect coronary arteries as well, which have to work harder anyway. Heart disease. Deficient blood supply to other parts of body damages the blood vessel accumulates heart failure. Treatment: reduce heart rate, reduce calcium flow in the heart, quit smoking, adjust diet, and exercise.
Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension.
People of all backgrounds can develop high blood pressure. Treatments differ based on risk factors including age and family history. But hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe one or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed, and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, leg cramps, frequent urination, or headaches. If you have side effects that don't go away with time, don't just quit taking your medication. Talk with your doctor and pharmacist, as there may be other medications or different doses that can control your blood pressure and have fewer or no side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers
and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits.
How's Franny?
She just graduated from obedience school.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon. Visit millionhearts.hhs.gov to team up with your pharmacist to bring your blood pressure down.